Hello, Kidney Warriors. James here from Dadvice TV, your online kidney health coach. And this is Dadvice TV Live. And for those of you that are new, go ahead and say new in the comments like Jane here. That way we can all get to know you. Tell us where you're from. And do you have kidney disease? Or do you have somebody in your family or a friend or a close person that you know that has kidney disease? Now, for those of you that are new, let me introduce myself real quick. My name is James, and I am not a doctor. What I am is a kidney patient. Now, almost 2 years ago, in November 2018, I went to the ER. Oh, it wasn't good. And I spent a week in the ICU. And on day 2 in the ICU, a weird doctor came in with a very long name and told me, James, you got some kidney problems. And it wasn't just problems. I was in stage 5 kidney failure. She told me I had to get on dialysis right away and get on a list for a transplant. Well, I'm a super nerd. I started doing some research and I wasn't sure if I really needed to get on dialysis because they got my GFR up and stable to 13, which isn't great, but it's not that bad. Well, I never went on dialysis. I never got a transplant. I instead worked with my healthcare team, a renal dietitian, my primary care physician, and a nephrologist to learn about kidney disease and make diet and lifestyle changes, which reduced the burden on my kidney disease, and I got healthier overall. Now, as I got healthier, my labs started looking better. I got to stage 4. Then I made it all the way to stage 3, but more importantly, because I really don't care about those stages, I got rid of every single symptom that I had. I have more energy. I feel fantastic. I am doing great. No magic pills, no secret potion, no magic herb, no spoons full of baking soda or any of that stuff. No, simple diet and lifestyle changes. That's what worked for me. May not work for everybody, but I got my kidney disease under control. So that's a quick introduction to me. Now, when I talked about my healthcare team, probably the 2 most important people were the nephrologist that knew all about kidney stuff and a renal dietitian. Last night, we had a renal dietitian on here live with us, Jen Hernandez. Tonight, we have a nephrologist all the way down in Texas. You guys know him, Dr. Butt. Hey, Dr. Butt, how you doing?
How's it going, guys? How's it going?
Hey, doing great. Now, let everyone who's new know a little bit about you.
Well, I'm Dr. Qasim Butt. I am an interventional nephrologist out in San Antonio, Texas. I am kind of, I try to focus in on social media, get that interaction with my patients and people like yourself. I do health-related content. I do videos all the time, education. They're only about 2 to 5 minutes long, kind of pinpoint your problem and talk to you about your problem really quick. And I try to make it fun, man. I try to make it fun. And that's why I'm here today, try to make kidney disease fun, if you can say that.
Yeah, tell
we're going to make dialysis fun tonight, right?
Where can they find all your videos at?
You got to follow me on Facebook, LinkedIn, Instagram, and YouTube. Your Kidneys, Your Health is my channel. Y'all, please follow that. Ask me questions. I post content probably every week or 2. Love your feedback. So please check me out. Your Kidneys, Your Health, and you can find me anytime at Qasim Butt MD at any of those platforms as well.
Awesome. And tonight our topic is dialysis. More
yeah.
Which type of dialysis is best for you? Now, me, I hope to never need dialysis, but the day could come as I age naturally, and hopefully I stick to my diet and my good lifestyle. It gets kind of hard at times. My doctor's getting on me. He says, James, you're getting too comfortable, too confident. You got to stick with it. So what are the types of dialysis? Let's start there.
Well, there are actually 3 types of dialysis: home dialysis. In-center hemodialysis, home hemodialysis, and peritoneal dialysis. So we have 3 different types that you can pick from. And unfortunately, so many people don't really know about them or haven't been explained to them about them.
Yeah, as a matter of fact, when my doctor wanted me to get on dialysis, the first thing she talked about was, oh, there's lots of locations all around here. It'll be real convenient for you. she immediately in her mind went to in-center dialysis.
And that is the default in America is, for the most part, is in-center hemodialysis, meaning you go to a center 3 times a week. There are other options too that you can do at home, which I would love to talk to you all about. But you know, the main thing is, James, I think people really have to, when you're making a decision about dialysis and what type is best for you, you really have to fit something that fits your lifestyle, right? And that's the main thing. Are you are you upwardly mobile person, going to work, want that active lifestyle, want to travel, want that autonomy, don't want to see nurses 3 times a week, be at a center 3 times a week? Or are you kind of weak? Or you kind of happy just going to a location and being served and getting the treatment there? So I think it's really for everyone out there who is late stage CKD. You guys are at CKD 4 and 5, meaning GFR is less than 30. These are options you need to explore and understand. So first, before you even understand what kind of options there are for dialysis, you need to understand yourself and what you want out of life. So if you still want to partake in life and do a lot of things, you guys should consider doing dialysis at home. And that's a big deal. Unfortunately, people are scared of that, right? Can you imagine doing dialysis at home, either hemodialysis or even peritoneal? People get really scared, and that's where the education really comes in. So
what's the difference between those 2 types of home dialysis? Or well, wait, let's do in-center dialysis first, because I think that'll be the quick one.
Yeah,
and I think a lot of questions are going to be about the at home, because if I was on dialysis, I would definitely be wanting at home so that I could keep up that active lifestyle and stuff.
And it's not just the active lifestyle, James. It's really the autonomy. See, I'm big about patient empowerment, but unfortunately, I feel like a lot of times in medicine, we just say, we need to do it for you. We need to do it for you. Well, to me, that kind of robs you of your dignity. You see what I'm saying? So if you're actually partaking in your care and actually doing your own dialysis, you get that sense of control back. And that's huge psychologically. And I've realized over the last few years, especially, that psychological, input, that psychological, pull is really important for people's daily life. We can talk about blood pressure and diabetes all day, but mental health and how you feel about yourself and your condition, like yourself, you took control of your health, right? You took control. And I want people that have that same level of satisfaction that you have. Maybe they can't avoid dialysis, but maybe they can control their lives while they're on dialysis.
Yeah. So I'll tell you, the thought of home dialysis to me, well, it sounds like definitely the way I would want to go.
Yeah.
But I don't know enough about it. And I am scared to death of the whole hooking up to a machine. There's some kind of ports on me. Am I sticking myself with needles? Are things going to go wrong? There's like a whole 1,000 questions.
Oh, no, absolutely. Absolutely. So, why don't we start off with what you just said? Let's talk about in-center, the default in America dialysis modality. Okay. The default in America, 90% of people in America that are on dialysis are on home in-center dialysis, in-center hemodialysis. That's kind of a word. That's kind of a word jumble right there. Right? Yep. In-center hemodialysis. So that means you're going to dialysis 3 times a week, either Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, and you're sitting on in a chair for 4 hours. 4 hours, 3 times a week. Okay. And what they're doing is they're putting a needle in your arm into an access in your arm. We did a show about that access, dialysis access. But you're going to get a needle put in your arm, 2 needles put in your arm, one to take the blood out of you, one to put the blood back in after it's cleaned. And they're going to stick you, and that's how they're going to do it. They're going to literally do everything for you. And in that scenario, what's going to happen is you're going to sit there, you're going to put your arm out. Oh, you see my arm? You're going to put your arm out, and you're going to sit there, and they're going to stick the needles in. You're going to kind of zone out a little bit, and you're going to kind of watch TV, read a book, do whatever you want. But you have to actually take the transportation there and take the transportation back. And it's 3 times a week. So because it's 3, you got to remember, our kidneys are working 24/7, right? Our kidneys are always working. They're 24/7 peeing. You're constantly peeing. That means you're constantly filtering and cleaning your blood. All of a sudden, you're just getting 12 hours of cleaning in a week. You see what I'm saying? From 24/7 to just 12 hours in a 7-day period. So that in those 4-hour sessions, they got to do a lot of work. They got to clean your blood a lot. They got to suck out a lot of fluid. Oftentimes, you're taking out 2, 3, 4, 5 liters at a time in that 4-hour session. Okay, and just so you all visualize it. Okay, just to visualize it, think of a 2-liter bottle of Coke. A 2-liter bottle of Coke. Sometimes we're taking 2 to 3 of those out of people in a 4-hour period. You see what I'm saying? So that can be kind of draining on people, right? That can be draining. Like people feel tired after doing that. And so
and it's
that's
tough on your heart, right?
Yeah, it can be. So you got to remember, like that much volume. Think about the volume. Let's just say, 1 to 2 2-liter bottles of Coke. That's a lot of fluid, right? Can you imagine sucking that off of you? And and dropping your blood pressure. It causes cramp. It can cause cramps, and it can cause and it can be kind of hard on your heart too, because your heart's a pump. It's pumping, right? It wants consistent blood flow. So all of a sudden you're sucking some of that fluid out. It's kind of it could be damaging to it too. So yes, obviously, like that could be a concern as well too.
Yeah. Oh, and I've heard that for some people, they are so exhausted. So they get up in the morning. Yeah. They maybe have a morning shift if they're trying to work. They go there, they do this for hours. And do most people then need a nap before they can go about their day or go back to work?
So, what I found, like, especially let's just talk about in-center dialysis. Mm-hmm. I found that, it depends on the person. It really depends on the person. First off, it depends, are you still urinating or not? That makes a big difference as far as your experience, because if you're still urinating like a normal person or close to being like a normal person, they don't have to take as much fluid off of you. You see what I'm saying? And so if they don't have to take as much fluid off yourself. Exactly. And you're kind of cleaning your blood too. That residual kidney function, even though your remaining GFR may be 5, whatever it is or less, that's enough to get enough volume or clean your blood enough to where you're not as drained post-dialysis. Also, if you bring in a lot of fluid, now we call these people kind of fluid abusers, if you would. The people that don't follow their fluid restrictions and they just drink and drink and drink, and they're bringing in 5, 6, 7 liters between dialysis sessions. Guess what? When they're trying to remove that, they're not going to go for that whole 5, 6, 7. They're probably going to go for 4 to 5. That's going to be draining on you. It's going to suck you dry, and so you're going to feel tired. Also, if you have heart conditions, you ever have other comorbidities, your experience is going to be less, and so it's going to be worse. So your experience really depends on your comorbidities, but also even like the attitude you bring towards it. I've seen people, like, again, you're a very positive attitude kind of guy, right? But if you were down, down all the time, and you bring that down attitude to dialysis, guess what? That experience is going to be really bad for you, right? Yeah. So what I always suggest with people with in-center dialysis is, create a community there. Have a support group. You have these in different cities too. You have these kind of support groups that people can join, and you have that sense of family or like communal, like a work family, if you would, and enjoy that experience. And I know that's hard to say, especially if you're sick, but I'm a fundamental believer that your psychology determines your outcome. And so if you bring a positive attitude or you bring a good attitude, then that can kind of improve the experience. So.
Yeah, and we had a couple nurses on here. As a matter of fact, one of them is right here in the chat. Steve Belcher, he runs.
I connected with Steve. How you doing, Steve? Yeah.
he's got his channel with tons of great videos for you guys that haven't checked it. Steve, type the name of your group. I always butcher it, and then I'll put it up here on the screen. Give him about 20 seconds for this all to get to him so he can type it all. But we had him and another dialysis nurse talking about dialysis, and they were talking about how sometimes people will come in there, they might play a guitar or ukulele or something, and people get to know each other really well in the in-center. And a few people that I've spoken to, there are some, not a lot, that usually they're much older than me, that kind of look forward to it because it is like a family there. Here we go. Steve put it. Urban Health Outreach Media on YouTube and Facebook.
So, no, you're completely right. I've had people like that get chair buddies. So every once in a while, the dialysis who may shift people's chairs for convenience or for whatever logistical purposes, and they get upset because their chair buddy that they talk to 4 hours, 3 times a week is gone. You even have this scenario where some people actually get kind of depressed because their chair buddy got a kidney transplant and they didn't. And all of a sudden there's a lot of play there. And I think like that psychosocial support is really needed for a lot of people. And unfortunately, a lot of times on dialysis as a doctor, you're too busy to address that. And unfortunately, a lot of people are just not forthcoming enough to tell you that this stuff is going on, in their lives too. So, the experience on in-center can vary per person, but I think that sense of community is really important. And, if you guys can build that, that'd be really good for you guys.
Yep. And I'll tell you, the majority of the views here on Dadvice TV come on mobile devices. And so many people tell me they watch these while they're getting dialysis.
Oh, that's hilarious. That's hilarious.
So, hey, we're reaching the right audience. We're getting right to the right people.
Yeah, no, and I hope, and they can, come on my channel or your channel and give us suggestions of how you can improve patient care. I think that's a big deal too. Unfortunately, a lot of people don't voice it, or don't tell us, as doctors. They're intimidated by us or whatever it is, or they think we're too busy or something. But voicing those kind of things is kind of important to us.
Yeah. Hey, that's the kind of person I am. I speak up. My doctors, I need the right kind of doctor, and they actually love it hearing from me. Hey, here's what I think. Here's how I'm feeling. Blah blah blah.
Yeah.
So that we can really work together.
And I love that. Like, so those are people on dialysis. It's cool having a patient that's interactive. So like yourself, if you were on dialysis, you could say, hey doc, I'm kind of cramping up. You mind pulling less 1 liter off, less than whatever, a certain amount off. It's like, yeah. Or doc, I feel like my ankles are swollen. Can you pull a little bit more off? That kind of interaction really kind of helps and makes the patient care experience a lot more better. And again, you got to remember, you guys are not suffering, but going through some things. But we want that satisfaction too of that experience as well. So,
yeah. Now, Steve was saying about repercussions. That's why some people may not say anything. I'm not sure what kind of repercussions there may be for saying something. Steve, can you let us know what you're thinking there?
Yeah. I would love to know what he means by repercussions. Again, I think it depends. Doctors are not all the same people, right?
Yeah.
We're doctors or nephrologists. We're not all the same personalities, right? So we like, some people like criticism, or not criticism, but critique or input, and some people don't. So there's a lot there, And again, Steve from the staff. Yeah, so that's another thing too. Some people don't like to be told what to do. A nurse is going to be like, I've been doing this for 15 years, and then that happens. Most nurses are actually really nice, but I can see what Steve is saying there, that sometimes that can happen. That, hey, why are you telling me how to do my job? Steve, I was glad that we have Steve here for his input.
Yeah. Now, besides the not getting it very often for in-center, it's just a few days a week, are there other downsides to going in-center?
Other downsides, again, like I think it's the toll it takes on you. It's kind of it's intermittent, so they got to do a lot in that 3 to 4 hours. The 4 hours, excuse me. And then also, because you're getting it intermittently, you have to watch your diet pretty regularly, like your potassium and your phosphorus. And you end up taking a lot of binders and things like that. Binders are foods you take, pills you take with your food to absorb the phosphorus in it. So there's maybe a higher pill burden there too. And so I think those are big deals as well too. Just the restriction in diet and things like that. But the lack of mobility, the lack of able to get up and go, do what you want during the day, that kind of thing. Now, just so you all know, those of you are on hemodialysis, you guys got to remember that if you want to go on vacation, you can go on vacation.
I was just going to mention that.
Yeah, you can. You can go to like say I'm in Texas, you want to go to Florida. You just got to make sure you set up a dialysis unit there. Now, I had some patients that wind up showing up somewhere in random place, or even here saying, hey, I haven't got dialysis and I haven't set up anything. Really, dude, it's not McDonald's, right? You can't just show up and like say, hey, give me some dialysis, supersize my dialysis or something, Like, you can't just say that. You have to actually schedule ahead of time. And again, what's good is about being in center. And this is true for all of dialysis. You guys got to remember, those of you not on it, you have a whole team around you as a kidney dialysis patient, a case manager, a dietitian, everyone's there for you. So you have that support.
Yep. And that's a great thing for people to remember. If you're on the dialysis, there is a renal dietitian there. They may not be in every day, so it's good to find out when are they available. For me, that was the best help I ever got. You got a lot of laughs here from your McDonald's joke.
Yeah. Well, some people treat it like McDonald's too. So there's complaints from patients. There's complaints that patients have about doctors and dialysis units. But guess what? It goes back the other way too sometimes.
So the other option, which sounds to me much better and maybe even easier on the heart because you're doing it every day, is home dialysis. Yes.
So we can go into there. So with the home, I love about it, again, like what I said, I love the autonomy of it. I love patient empowerment. I love the fact that you're taking care of yourself. But the great thing is the sheer fact that you're doing it almost every day. Now, home hemodialysis is done 5 days a week, 2.5-hour sessions. McKidneys, really?
McKidneys. Awesome, Joyce. Great one.
Yeah, or burger kidney, maybe. No.
I like McKidneys.
Okay. Kidney fillet? No, I don't know. Okay. Anyway, so again, so home hemodialysis, where you're doing the blood dialysis at home, it's 5 days a week, 2.5 hours each session. Peritoneal dialysis, the one that's in the stomach, which involves no blood or needles, that's every day for 8 hours every night. Okay, so
is that the one where you end up with UPS delivering a room full of boxes?
Yep. Big bags of fluid. And like we talked about vacation, by the way, Guess what? If you want to go on vacation, the airlines will actually let you take all that stuff on for free. So either if you're at home hemodialysis or home PD, you are going to be able to take that stuff with you on vacation. So it winds up being a pretty good deal from that perspective. So you have your autonomy. And what's good is with these home modalities too, what I want you to understand is that you have access to a nurse 24/7. It's not like you're by yourself. You're not going to be like messing with the machine and calling tech support in India to figure it out, right? You're going to be like literally have a nurse on call 24/7 to answer all your calls. You'll see a doctor once a month. You'll see the whole care team once a month, but you'll have you have access to a nurse all the time, and so it's pretty good. Now for the as far as qualifying for that, who qualifies? That's a different story. So not everyone would qualify or would consider it.
What are some of the qualifications or some of the things that might get you unqualified?
Well, so big thing with home hemo. I think they're coming out with machines otherwise, but for the most part, with the home hemo, because you're taking the blood out of somebody and putting it in a machine, like we talked about, your blood pressure can drop, you can cramp, you can pass out. Yep. They typically want you to have a partner there with you, a spouse, family friend, whatever it is, someone close that stays with you. You see what I'm saying? And because God forbid you pass out, someone is there and you're not bleeding all over the floor or something. You see what I'm saying? That doesn't happen that often, but that's the thing. So you need that home support there, right? So what's interesting is even before you you qualify, you got, first off, your doctor has to think you're competent enough to do this. You see what I'm saying? So the doctor has to really think, hey, can this patient do this? Now, I happen to think most doctors underestimate their patients that they can do it. I think there's a lot more patients that can do it that don't do it. But the doctor has to qualify. But the way that starts, guys, everyone out there that is on dialysis or CKD 4 or 5, you need to insist to them that I want to do this. Do you see what I'm saying? You need to tell them, no, I'm willing to do this. And that's going to change their mindset about you as well. So they're going to decide, first off, is he competent to do? Do they have the family support? Can they read well? Can they see well? Like I've had people with dexterity problems, right? Like either had what we call diabetic neuropathy, where their fingertips are so numb that they can't manipulate things. You see what I'm saying? So does that correlate in there? Does that patient have a good house? If someone lives in a mobile home, do they have access to good water? You see what I'm saying? Access to good electricity, a consistent supply of electricity. So those are things. So they're going to actually make a home visit to your house to determine, hey, this house is good enough for them to have that done. So that's one of the main things too.
Now, the two home versions, one of them you talked about uses the stomach. Is the other one a blood one that takes blood out and puts it back in?
Let's separate it out. Home hemodialysis and home peritoneal dialysis. Home hemodialysis, and again, guys, just so you know, I did a video on this. You can check it out on my YouTube. Dialysis Made Simple. It's 5 minutes and explains to you these three forms of dialysis. But the peritoneal dialysis, the home hemodialysis, is just like the in-center. It's just like the in-center. You're going to have an access in your arm. You're going to have to either have to stick it yourself or get your wife, husband, spouse, whatever, to stick it for you. Okay, so you're going to have to actually endure needles there too. So you're gonna
one moment, when you have the access,
yeah,
is it completely under your skin and you're sticking the needle through your skin into it?
Yep. So it's either it's like your own vein. You know, you have these veins here, these small little veins.
Yeah.
Think of it like a supersized. Yeah. So it's a supersized vein. It's literally a vein that's been supersized, that's been connected to an artery. So it's, instead of just pumping passive below, if you look at your veins, they're blue. That's because they're passive blood flow, right? They're deoxygenated blood. All of a sudden, what you do, you take that vein connected to an artery. All of a sudden, that artery is pumping blood into that vein, making that vein bigger and bigger and bigger. And that serves as the access point for dialysis. So that's true for in-center hemodialysis and home hemodialysis, by the way. But you're going to have to either stick it yourself or get your wife, husband, whatever, to stick it for you. So that's the other thing. So again, if you don't like needles,
I like insulin needles. Those little teeny tiny ones. Those are the only ones.
Oh my God. Okay. So yeah, those are some big old needles. But from what I've heard is that people do eventually get used to it a little. They do get used to the stick. The area kind of gets deadened. You build up some scar tissue, and so the pain is not as bad as what you first think. You see what I'm saying? Yes, I imagine on the first few tries, especially first few weeks, it's going to hurt. But after a while, you may get used to it. Also, there's lidocaine creams and numbing creams that you can put on top too. That goes from there. So,
yeah, Jonathan says his wife was his caretaker. He did both in-center and home dialysis, or hemodialysis.
Oh, okay.
Yeah, home hemo.
Okay. And so that's the home hemodialysis. Now the home hemo is, again, 2.5 hours, 5 days a week typically. And again, these prescriptions I'm giving you guys, these are kind of the average. I want you to see some of the comments. Like some people go 3 days a week, 3.5 hours or 3 hours, but the average is 4. So what I'm giving you is relative. So 5 days a week, 2.5 hours a session. That's what home hemodialysis will be like. So.
Yeah. Oh, so if you're having the one that's in the stomach,
yeah,
how are you connecting up?
Okay, this is actually pretty cool too. Right? No needles. So instead of you connecting to your here with needles and blood, there's no blood or needles involved. Okay, so you literally have a tube, a catheter, directly into your abdomen. Okay, so you have a tube coming out, not like a feeding tube, but like a tube into your abdomen.
Yep.
Now it's not going directly into your stomach, it's going into the cavity, what we call the peritoneal cavity, that surrounds all your organs. Okay, and then you actually through that tube, you're going to take a big bag of clean fluid, typically around 2 liters or so, empty it directly into your abdomen. That clean fluid will sit in your abdomen, kind of use the peritoneal space and the organs and the membranes in there, and actually use that as a filter. And that fluid will sit there for a few hours, and then that clean fluid will absorb all the toxins, absorb all the extra fluid, and then you'll drain it out after a few hours. Okay. And that's actually, I just described what we call manual exchanges. So you can do those 4 or 5 times a day, literally manually hang it up here. Sorry, here. Well, I can't get it in here.
Manually, it's really narrow.
Yeah. This is kind of like the opposite. So you manually hang the bag on a pole, have it drain in 4 to 5 hours, and leave it in for a few hours. Do it 4 to 5 times a day. Then you have the automated version, which is literally like an old school VCR sitting by your bedside at night. This is the other option. And at night, what you do is you literally are going to connect that machine to your tube in your abdomen, and you're going to have these bags of fluid on that machine. And just so you all know, this stuff is so simplified now. Like some of these machines actually talk to you and tell you what you're doing. And the bags are all color coded. So there's different bags, but it's red, green, and yellow. So it's very simple. Everything's somewhat is automated. And you just put those bags, 2 greens, 1 yellow, and you press the button, and then you essentially go to sleep at night. And over the course of about 8 hours, and again, someone commented about 8 hours not being, it could be 9, depending on the person. But roughly around 8 hours or so, they push that fluid in, pull that fluid out. So that machine is automatically just kind of pushing fluid in, pushing fluid out. And
Joyce asked that, how does it get out? So it's kind of like sucking it out
Yeah, yeah. So it's pushing fluid in, pulling fluid out, and it's kind of a natural tendency for it to come out because it's kind of inflating you a little bit.
And you do
So
this while you're asleep.
yeah, well, you connect yourself while you're awake though. But
Yeah.
yeah, but
And
yeah, you do while you sleep.
and I know you're not on dialysis, but I'm sure you've talked to plenty of patients. What's it feel like? Are you able? I move when I sleep. My wife hates it. In the morning, all the covers are all on my side and half off the bed.
Yeah. Yeah, maybe you have night nightmares or whatever,
Yeah.
Like, yeah.
That's when
So,
I exercise. When I dream exercise.
yeah,
It's
you know
not
what the thing
working
is,
too well.
I move around too. Get up, go to the bathroom and stuff like that too. So that happens. But you can move around a little bit. But I think you have to kind of limit your motion a little bit. Now the thing is, one of the drawbacks is some people have these things they sometimes have pain when the fluid is going in initially, especially the first few times. Because you got to remember, it's going into your abdomen and causing your internal
You're putting quite
body
a bit
to
of fluid
expand.
in there.
2 liters at least, sometimes 2.5, depending on the person. So you're putting a decent amount of fluid in there. So that can cause pain. Then there's also something called drain pain that can happen when you're pulling off the fluid. And there's actually a drain pain when the body's just getting rid of the fluid. So there's, again, nothing, I want to understand this. No modality is perfect. There are complications of this there. So, but at the same time, I think these modalities, especially the home ones, are good options for a lot of people, and they're actually grossly underutilized in the United States at this point. And so I think we're going to be pushing these modalities over the next few years. So,
well, and that was part of the executive order that Trump signed, was to get more people doing home dialysis.
Yeah, and that's it, because you're getting dialysis almost on a daily basis, or almost on a daily basis. So your fluid gains aren't as much. You're not gaining, and your toxins are being removed on a daily basis, just like you do normally, right? So it's kind of fitting your schedule more normally. And you know how we talked about it being a drain on your heart when you go for that 4-hour session and drains? Well, you don't have as much of a drain on you. You see what I'm saying? Because it's not as hard on your heart. And it's been shown that these home dialysis modalities, they have less hospitalizations. And those of you out there, guess what? The biggest cost to U.S. healthcare is these hospitalizations, because when you're in the hospital, it costs the insurance company, whoever it is, Medicare or whatever, $2,000-$3,000 a day to house you there. So the hospitalizations is what they want to avoid. And these home modalities keep you more normal, I would say, or more equilibrialized. And so you actually do better and get hospitalized less, which is a good thing as well too.
Yep. And Betty here says, it sounds scary. I agree with you, Betty. This is motivation to stop smoking if you're a smoker, to eat healthier, to exercise, to lose weight, to do everything you can to try to slow down your decline in kidney function and delay or maybe even avoid the need for dialysis.
And so I don't know, Betty, but Betty, like, I'll be honest with you, it depends on how old you are and how you're doing in life, right? So, if you're 80 years old, 85 years old, or late 70s, whatever, and you say, I've had a good life, I don't want dialysis, I don't want to live that life, that is your choice. And I think that should be respected, and you may not want to do dialysis. But if you're a 45, 50-year-old person that's just scared of dialysis, that's not a good option of dying naturally. I don't believe you die naturally at 45, 50. Dying naturally is normal at 75, 80. So, and the main thing, that's why I do my videos, and I think it's what James does, the scare gets taken out with education. So you got to watch videos on this. You got to hear us talking about it. You got to watch, my video on it, but other people's videos on it, and see what they're about. And it really takes the fear out of them.
Yeah, and I'll tell you, I don't talk about dialysis very much because I have no experience with it. And I am cringing on this and with the needles and stuff like that.
Oh, yeah.
But I know if I expose myself to it more, I would become more comfortable with it. So that, that supports that. The more we learn about it, the more we understand it,
absolutely,
more comfortable we will become with it. Now, there was a couple questions I wanted to make sure we touched on. We did mention that it is easier on the body doing it at home. Mm-hmm. It's kind of better for you because you're getting treatment more often.
Yeah.
We took
one more thing.
Yep.
Your diet is you can watch your diet less. So all those restrictions on potassium and phosphorus, they can go down a little bit. Now you can't go buck wild. You can't have a potassium, I was gonna say orgy, but yeah, you can't just have you can't have like a potassium, buffet or something. But guess what? Your restrictions on potassium oftentimes go down. Maybe you don't even have to restrict it. Phosphorus, your binders load is less too because you're getting cleaned every day. You don't have to take as many binders. So that's another definitely positive thing from a life perspective.
Yeah, we got some people agreeing with me. They're okay with needles, but the big ones.
But not the big ones.
Now, Jane was wanting to clarify, is peritoneal dialysis as safe as hemodialysis as you age?
Yeah, I don't see a counter like, yeah, no, I actually think it's safer. So those patients that have a lot of comorbidities, like say a 70-year-old that has really bad congestive heart failure or really bad liver cirrhosis, I actually have one in mind that I saw today. Oftentimes their hearts are weak. So I would rather do peritoneal on them because it's gentle over 8 hours on a daily basis. It's not going to be as hard on their heart. You see what I'm saying? So I'm a big fan of it, especially for that purpose. So I'm a big fan of peritoneal overall, and I actually think we should have a policy in the United States of peritoneal dialysis first. Actually, most countries in the world are dominant in peritoneal dialysis. They're like 60, 70, 80% peritoneal and only 10 to 20, 30% hemo. But we in the United States like to do it big, right? So like we go more expensive, right? And so we chose hemodialysis, and I think it's a kind of a group thing. You realize in our nephrology training programs, remember, we're human beings, right? Nephrologists are human beings. We're not just scientists. We are trained on hemodialysis, and especially in-center hemodialysis. So that's what we push out. You see what I'm saying? So you came to my clinic, a year out of fellowship, I'm probably going to push home in-center because I wasn't properly trained on home modalities.
Yep. Now, what about infections? Doing it at home, especially with the needles.
Mm-hmm. So what they're taught is what they're taught. What you're taught, especially, you got to remember, you're going to get so much training. This is not like, yo, here's your dialysis machine.
We didn't even talk
needles.
About that.
Yeah, this is not
How
like.
Do I learn to use these machines?
Yeah. It's not going to be the heroin addict's guide to needle using. It's going to be like, it's going to be like a very detailed course. You're going to get training. You're going to get, even with peritoneal dialysis, you got to get trained for a week or 2 or 3. Home hemo, week or 2 or 3. You bring your support people with you, your family, whatever. So you're getting a constant training. And one of the main things they're going to teach you about is aseptic technique and keeping everything clean. So your idea as a regular person, non-clinical person of clean is not clean. You see what I'm saying? Mm-hmm. From a medical standpoint. So they're going to teach you wear these sterile gloves, wear this mask when you do this, clean this using this technique, and make sure it doesn't touch anything. You know what I'm saying? Unfortunately, some people think they just wash their hands or haven't touched anything. It's clean. It's not. So you're going to get that proper training as far as infections and stuff like that as well too. So you can get infections on home hemo and in-center, on hemodialysis in general. Less likely, though, that doesn't happen that often, the blood infections or or fistula infections. Where the infections really happen is when you have a catheter in your neck. When you're at the hemodialysis, you have the catheters hanging out. Maybe some of you are out there have it. But those are really
what they wanted to do when I was in the ICU was to put a catheter up here for now and then later somewhere else. Yeah.
So they're gonna, because your story is different, man. You went to the hospital with a GFR of 5, and they're like, "Yo, we got to start dialysis on this guy." They don't have time in that scenario.
I was almost double
8. Oh, sorry.
8. Woohoo!
Oh. 8. I was giving you credit for your improvement, sir. I was giving you credit from going from a 5 to a 33, but you kind of took it down a little notch. But okay. Anyways, but yeah. So where was I going with that? So, but in your scenario is different. They thought you need to initiate dialysis right away. So if any of you, God forbid, rush to the hospital and they need to start dialysis, guess what? They don't have time to put a fistula in your arm or a graft in your arm and let it heal, because it takes several weeks for it to heal. 2 to 3 weeks, anywhere from 2 to 2 months, 2 weeks to 2 months for it to heal. So and that's
urgent until it's healed, right?
Exactly. So that's going to take a while. So that's not an option in that emergent setting. Like you were in the ICU, right? So they're not going to do that right. They're not going to do that right away. So they're going to put a catheter in your neck, and those catheters are kind of more predisposed to getting infection. So if any of you people out there are on dialysis, and you have a catheter in your neck, you got to wonder why I don't have an access in the arm. And so that's the main thing, is get those catheter rates down. Now, the peritoneal dialysis, that has a catheter too, and that can get infected too. I'm not going to lie. So again, no modality is perfect. Please do not think I'm saying, peritoneal dialysis is perfect. It's my option of choice for a lot of people, but I realize it's not perfect for everybody. You can get infections. You can get what we call exit site infections, where it comes out of your skin right at the exit site. You can also get infections in the peritoneum itself. Sometimes that happens. Now, they try to prevent that, again, by using aseptic technique and you guys doing it properly and stuff. There's no perfect way to do it. But apparently you have to be very,
Yeah. Now, Lori had a great question. Can you do peritoneal if you are alone?
Yeah, I think so. I don't think
you're good.
Yeah, I don't think there's a problem with that, like as far as peritoneal, because the chances of your blood pressure dropping are not that high. I don't think you have to have necessarily the home support as much as, say, the home hemo for sure. Yeah.
And then Joyce has a great question about peritoneal. What about exercise? Am I good to go out and do exercise? Do some sweating to the oldies? Anything like that?
Ooh, that's an extremely good question. So, the thing is, when you're putting fluid in your abdomen, you're kind of expanding your abdominal cavity a little bit, right? So, you may be at risk for getting what we call a hernia, right? So that abdominal wall, a hernia is literally, this is your abdominal wall, right? Like the parenthesis is your six pack. A hernia is literally a hole being poked through that abdominal wall. And if you have fluid built up in your abdomen, that fluid can kind of leak out and cause what we call a hernia. So yes, in certain respects, you may need to watch what exercise you do. I wouldn't do any six-pack abs, super training, CrossFit stuff. You see what I'm saying? And we've talked about exercise on the show. And I really believe in slow and steady, starting out slow and steady. There could be some of those, CrossFit powerlifters, that are on dialysis, but I would not recommend that as a starting point for 99.9% of dialysis patients. So, you may have to watch the ab restriction and not overexerting yourself.
And then Lori has another great question, and I've heard conflicting answers on this about having pets and doing dialysis at home. She has 4 dogs. Awesome that you're a dog lover.
Yeah, I just got a dog, just so you know, for the first time. And I saw, and I watched her eat a turd the other day and disgusted the crap out of me. I had no idea dogs were that. Oh, yeah, I did not talk to her the rest of the day after I saw that. I was like, this is the most disgusting thing I've ever seen a creature ever do. So I do love her, though. She's a great dog.
Watch the monkeys.
No, I don't tolerate fecal philia, I guess. What is it? But yes, dogs. So yes, we talked about cleanliness, right? We talked about cleanliness and being aseptic technique and the idea of cleanliness. Guess what? Your little poodle there is not clean. Okay, they're full of bacteria. Okay, so when you have dogs or cats or whatever, you have to have a clean room dedicated for this. Like, I've literally had people tell me I can't do peritoneal dialysis because I have my dog sleep with them and I love sleeping with my dog. Yeah. You see what I'm saying? And so you're going to have a clean room where the dogs, cats, whatever, don't have access to have all that stuff there. So that's another thing too. You can have dogs and cats, but a separate room is necessary. Okay?
Yeah. Now, pardon me, got a little bit of a cough here. Jane is asking, on your experience, how much space you kind of have to dedicate to all this, all the supplies and everything and the towels and the fluid. I've seen pictures on Facebook and it is shocking.
Yeah, there's a lot of fluid, dude. There's a lot of fluid. I have not seen it. I haven't seen it in my living room, so I don't know the exact comparison. But yeah, it's a room worth, or at least a giant closet worth of stuff. And sometimes they get over delivered too. So maybe some of those pictures you see are when they double delivered or something too. But there is a lot of supplies there. But again, I think I think it's worth it, but you do definitely have to have a room for it for sure. I actually had one guy, it was interesting. He had a shared living space with other people. So he lived in a shared living space, meaning like, where they have a common living room, and he was doing peritoneal dialysis at home, and they actually agreed to let him store the stuff in his living room. So.
Wow. So when it gets delivered, do they bring it all the way into the room for you? Because I've seen it's a lot of stuff. That's got to weigh a lot carrying it all in.
I don't work for UPS, so I'm not sure. So
maybe somebody out there can tell us in the comments.
Maybe the FedEx employees out there, and they can tell us.
Do they bring it in for you? I'm hoping they do.
Yeah, I'm pretty sure. Those little ladies and stuff that are out there. I guess it's called white glove delivery. Maybe that's what it's called, right? White glove delivery. So no, I would assume so. Yeah, I would assume they would help. 74 boxes first delivery. Jonathan Chitrella said, "Wow, that's amazing. 74 boxes. That's crazy."
That's a lot. Now, Jane,
I get it delivered by Amazon every week, by the way. But like at this point, go ahead.
Can you do dialysis in a motorhome?
Yeah. Oh, so I've actually which one dialysis? Which one, by the way? I don't know which. Either one,
so
I guess.
Jane, which kind of dialysis are you considering, and what have you seen, or what do you believe can be done in a motorhome?
So I've actually heard a story. One of my partners actually had one that was doing a home hemodialysis on an RV. So he was at the retired phase of his life where he would travel on an RV, and the dude actually apparently was doing home hemodialysis while driving. Okay. I would not suggest that because he actually got pulled over by the cops, and they had to call my partner and let him know that, hey, this guy is driving with this machine connected to him. Is it safe? So, ideally I wouldn't do that, but yes, you can do it on an RV or
there she is, peritoneal.
Yeah, peritoneal. I would think so. Yeah. Again, you just have to make sure that you have that consistent electrical supply. And that stuff, and to, so you may get a discount on your home electric bills and stuff like that too. So there's things out there for those of you out there on dialysis. And remember, there's a lot of amenities or discounts and things available. So always ask your case manager at the facility, or social worker, not case manager, what's there? Like what can I do for my electric bill? What can I do about this payment? If my medications are too expensive, don't ever think you're alone. Don't be scared. Don't be scared to ask, because there's a lot of things out there. Again, just like I said, flying, right? Flying and knowing that your supplies are free, that kind of stuff. You should know that. And just so you know, there are cruises out there, guys. There's cruises for people on dialysis too. So there's those available. And apparently they give free tours to nephrologists if you agree to be the nephrologist there. But
busy, I think.
Yeah. I was like, I don't know if I want to leave vacation from nephrology and be a nephrologist. That's not really a good vacation, but yeah.
Yep. Now we have here's a great question. How can we reduce bumps on fistula produced after wrong needling? Any recommendations there?
So I'm not sure what he means. Was that Syra? I forgot that name. But anyway, Syra, yes. Anyway, so I'm not sure if you mean by bumps, do you mean aneurysms or you mean just bruises? Okay. So the bruises are occasionally going to happen. So I want everyone out there to know that occasionally, so you got to remember that fistula under your arm is like a tube, right? Like a tube. So you got to imagine you're sticking a needle in that tube, right? You're sticking a needle in that tube. Guess what can happen sometimes? Either they sometimes go through and through. Sometimes you move or they move, and you can get a bruising underneath the skin because the needle is moving. Do you see what I'm saying? So those kind of things sometimes happen, okay? The other thing that can happen is something called an aneurysm. Aneurysm, again, like if you think about it like a circle, right? The tube. Sometimes it's like an outpouching where it kind of balloons. So you have that segment of your vein in your arm that kind of balloons. Now the way to prevent that is moving the needles in different locations every time you do dialysis. So you can do that as well too. So make sure that your tech is there, that they move the dialysis needle around a little bit and not stick in the same spot over and over again. Otherwise, it's going to cause weakening of that vessel, causing it to balloon up a little bit.
Yeah. Oh, again, that was the other one that's getting me kind of like, oh, the needles.
Yeah.
I never thought about that going a little bit too far. Now, you mentioned the cruise ships, and I think you got some excitement over here. Do they support like all the different types of dialysis, Or is it only one
So,
specific type dialysis on those cruise ships?
so I do not work for Carnival or Royal Norwegian, Norwegian,
Kidney
whatever.
Cruise Inc.
I'm not a cruise employee, and I wouldn't advise anyone go on a cruise right now with COVID. Okay, so don't everyone go tomorrow. It's like I'm going on a cruise.
My
There's a
this
nephrologist
doctor on
on
the
YouTube.
internet said go on a cruise.
Yeah. So I'm not recommending going on a cruise. So they actually have hemodialysis cruises. So specifically dialysis required for hemodialysis. Okay, so you can actually go on that, and they'll actually have dialysis centers there on the cruise ship there. Now, as far as the peritoneal, from what I understand, and I believe I saw somebody there that was sneaking in supplies or not sneaking in, we're actually bringing in supplies onto the cruise ship. I think they were doing peritoneal, so I can imagine they are. But again, you need to call that cruise line specifically and let them know, because sometimes cruise lines do go through your stuff, right? And they're going to be delivering all these packages. You got to make sure that they're aware that you're going to be doing that. So again, you may want to run that by, call up Carnival, call up Royal Caribbean, Norwegian, whatever it is, and say, hey, I'm a person on dialysis. Can I bring my supplies and everything, and see what their policy is, you know?
Yeah, don't treat them like McDonald's and just show up and say, hey, where's the dialysis machines?
Yeah, exactly. Although their food is sometimes equivalent to McDonald's, but I'm not going to go there, but whatever. You know?
Now, a lot of dialysis patients, and I was surprised that this question just now came up. A lot of them, when you see the arms, they have the large
aneurysm
balloons, I guess, is what one of the commenters call them. Is there a way to get rid of those, or does it require surgery?
Okay, so that's a good question. That's a very good question. So an aneurysm, again, so you have this tube, right? But somewhere along that tube, you get outpouching or ballooning. So literally you have a balloon on a segment of normal tube or normal vein, right? Now, it really depends on the rate at which that ballooning is happening, okay? So if your fistula is this big one day and next week it's this big, that's pretty scary. But if it got over 5, 6, 7 years got that big, it's less scary. Do you see what I'm saying? Because it's like a gradual increase in size. Yeah. So, ideal, and if it gets too big or if the wall gets really thin, you can get it what we call revised. So the surgeon can go in there, resect that segment of vein, maybe put a piece of graft or put something in there to actually connect it, but reseal it, but you can. But they're not going to do it just for cosmetic reasons, guys. And I know a lot of people, especially women out there, they hate having those things on their arms, and it looks ugly, and I understand that. But, you're a person that's a high risk. They're not going to risk doing a cosmetic surgery to get rid of something for cosmetic reasons. There's got to be a medical reason to actually get those revised and removed or fixed.
And it's cosmetic surgery, so that means you're paying for it.
Yeah. They're not going to, Medicare or whatever is not going to be like, oh, fistula ugly is not a diagnosis that you can bill for. You see what I'm saying? It has to be a real reason as to why pain along the access, the wall is getting thin, it's expanding really fast. One of those reasons where you're scared it's going to burst. You see what I'm saying? Or God forbid it's infected, something like that. If they're infected, they'll do it. But, it's just because it looks ugly, it's not going to be a major reason there. So.
Well, we are at the very top of the hour. Are there any last things you want to add that we didn't cover during the hour?
I just want you guys to be open-minded, really do. And explore your options. Education is key, but you got to self-educate. You can't rely on the doctors, nurses, dietitians, and case managers to tell you things. You got to search it out and then ask them the questions. But home hemodialysis, home hemo and home peritoneal, you guys need to look into. Don't be scared. Say, hey, how do I do this? And then you get training. They'll train you. So if you chicken out last moment, you want to go back to in-center, you can do it, okay? But also, if you guys can like my channel, Your Kidneys, Your Health, and follow me on LinkedIn, YouTube, Facebook, Instagram, whatever, it'd be great. I love your feedback, and I love being here, James, so thanks for having me.
Yeah, so remember, it's Your Kidneys, Your Health on YouTube. So click the subscribe button for Dadvice TV if you haven't. Then go over, do a search for Your Kidneys, Your Health. Subscribe there so you get all the doc's videos too. And also his Facebook page, Your Kidneys, Your Health. Look for it on there. All right, everybody. It has been another great night. And tomorrow night, I am back live with a brand new renal dietitian, someone you guys haven't met before here on Dadvice TV. And we are going to be doing a cooking demo, making a kidney-friendly Italian meal. And you guys are going to get to learn about a whole bunch of new products that I recently discovered that are designed for kidney patients. Low phosphorus, low protein, low sodium, low potassium, but full of taste. All of that tomorrow, 6 p.m. Eastern time.
James, are you the Martha Stewart of kidney disease at this point? Is that what's going on here, sir?
I'm not doing the cooking. I just do the talking.
Right. You're just the eye candy.
I've got boxes of samples that they sent me, and oh my goodness, they sent me a few boxes of these things. The brand is called Flavis. I don't know if you've heard of them.
Oh, okay.
They sent me boxes of stuff to try. It didn't last long. I ate it. I was like, oh my goodness, this is so good. I love it. And then they
let them know I have an address too, okay?
And then they said some more, and they got a renal dietitian. They said, hey, she can cook stuff up if you want and make videos with you. I was like, fantastic. More great information for all of us kidney warriors out there. All right, everybody. It's been a great night, and I will see you in the next video. Bye, everyone.